First up on Fineprint, well, the United States could be headed towards what many believe will be the hardest week of the coronavirus pandemic. The U.S. Surgeon General has said this week is going to be the hardest and the saddest for Americans, describing it as a Pearl Harbor moment and a 9/11 moment. But as fatalities in New York have dropped for the first time, many see a glimmer of hope, including the U.S. President Donald Trump.
We hope we're seeing a leveling off in the hottest spots of them all. So we'll see. You'll be seeing that over the next few days. Let's see what happens.
New York, which is the epicenter of the outbreak in the United States, reported around 594 deaths in the last 24 hours. The state has reported more than 122,000 cases, roughly one-tenth of the worldwide total. In his daily briefing, the New York Governor, Andrew Cuomo, said that there was still some good news. The number of people discharged from hospitals in New York was 3 times the number of newly hospitalized people. New hospitalizations also fell by a record 50%. This has now relieved some stress off the already stretched healthcare system. New York City Mayor Bill Blasio also pleaded help, calling for more ventilators for the city.
Please, we need your help. We need supplies. We need medical personnel to come forward to volunteer. We will compensate them, but we need them to come forward and give us their time and energy where it's needed most.
Meanwhile, other parts of the country are now witnessing a surge in the cases. Louisiana has become a hotspot for the virus, reporting a jump in deaths to nearly 500 and more than 13,000 cases. Interestingly, the massive outbreak in the state is being linked to the Mardi Gras celebrations that took place on February 25th. Mardi Gras was celebrated with the traditional 2.5-hour parade in New Orleans, with thousands of people attending the event. So why did Louisiana allow such a massive celebration? Well, the governor there said that he wasn't warned about cancelling the celebrations, but Edwards and other governors were briefed on the pandemic by the CDC Director Robert Redfield and leading immunologist Anthony Fauci. On February 9th, the briefing came at least 2 weeks before the celebrations happened. So the question remains, why was the Mardi Gras event allowed in the first place? Now, places such as Pennsylvania, Colorado and Washington, D.C. are also starting to see a rise in deaths. Most states have ordered residents to stay home and to slow the spread of the pandemic. But 8 states, all of them with Republican governors, are yet to order residents to stay home. In a grim prediction, the White House medical experts have forecasted that nearly 100,000 to 240,000 Americans could be killed by the pandemic. Meanwhile, the USS Theodore Roosevelt Navy Captain Brett Crozier has also tested positive for COVID-19. Crozier was fired after his widely publicized plea asking the Navy to halt the spread of the virus on the ship. The number of crew on the nuclear-powered aircraft carrier who have tested positive has risen by 13% in the past 24 hours to 155. Well, Simon Marks is now joining us live from Washington for the latest on the situation in, the United States. And Simon, as we were pointing out there, that New York is seeing some reduction in the number of deaths, but there are other hotspots now emerging in the United States. Are we hopeful of seeing a flattening of the curve anytime soon in New York and elsewhere?
Well, President Trump is definitely hopeful that the curve is flattening. He took to Twitter a short while ago and declared that there is light at the end of the tunnel. I'm bound to say that in New York City and the other key cities that are hotspots across the United States, doctors, medical professionals, intensive care unit staff feel very much that they are still in the middle of a very dark tunnel, and they don't feel as though they're seeing the light at the end of it. But the numbers from New York, the number of deaths, have slightly fallen away over the weekend. We will have to see what happens when new numbers are published in a short while by the governor of New York, Andrew Cuomo. I mean, the real concern of healthcare professionals on the president's own coronavirus advisory task force is that what's happening in New York right now, which may well be the peak of infections in New York City and New York State, will soon be witnessed in other cities across the country, including New Orleans. You were talking there about the influence that the decision to continue with the Mardi Gras celebrations had on the flare-up of coronavirus in that city. Detroit in Michigan, where things are very bad. Dallas in Texas, where things are very bad. And another emerging hotspot, which is in Florida, where, of course, spring break, the annual rite of passage for teenagers all over the country, was allowed to take place. And so many of the teenagers who headed to the beaches of Florida for spring break celebrations then took coronavirus infections back to their hometowns. That played a substantial role in increasing the spread of infection here.
Certainly, and of course many believe that the worst is still to come with the Pearl Harbor sort of moment or 9/11 moment coming in America. But it seems that the president is quite stuck on the malaria drug, asking countries all over the world to send the drug, and believes that it's going to help, even though doctors in his own administration are not so sure.
Yeah, I mean, it's extraordinary. He has become, President Trump, I think, somewhat obsessed with hydroxychloroquine for reasons we don't fully understand. There are some limited studies that suggest that for some coronavirus patients it might be useful, but nothing in the clinical studies that would lead you to conclude that this drug is, as President Trump recently described it, a gift from God. Nonetheless, he and leading figures within his inner circle have absolutely embraced it. We saw the extraordinary scenes at the White House yesterday, where the President of the United States, who concedes he has no medical training whatsoever, is not only urging Americans to start using this anti-malarial drug and promoting it as an effective tool against coronavirus, but when his own director of the National Institutes of Health at the same briefing was asked by reporters what he thinks of hydroxychloroquine, President Trump wouldn't let him come to the microphone and silenced him and wouldn't allow him to answer the question. So there is enormous tension behind the scenes between the scientists, the experts advising the president, and some of the political figures around President Trump, including the man who was his China trade negotiator, Peter Navarro, who were saying, let's get all over this drug in case it turns out to be effective and in case it turns out to be the magic bullet that can then put the American economy back on the path to recovery. It's an extraordinary set of circumstances.
Well, absolutely, Simon. And just before I let you go, there's also worry that there's not enough testing happening, and those numbers could really dramatically shoot up, from 100,000 to much more if there was more testing that was to happen.
Well, the president said over the weekend that the United States has now tested in excess of, 1,600,000 people across the country. And if that number is accurate, it does represent a massive increase over where things were just 3 weeks ago. And now they have these fast throughput tests. In fact, President Trump himself underwent one just a few days ago at the White House that provide results within 15 minutes. So there is an opportunity, definitely, to increase the amount of testing that's done. And with every test, the medical professionals here, of course, gather more useful data about where coronavirus is heading in the United States. That is for the present and the future. I think that there is going to be, when this is all over, a huge inquiry into what went wrong with the testing right at the beginning. President Trump keeps blaming it on an obsolete system he claims that he inherited from the Obama administration, but medical professionals say, well, COVID-19 wasn't around during the Obama administration, so very difficult to pin the blame on the former president for the failure to test sufficiently and sufficiently early when coronavirus first arrived in the United States.
Right. Simon Marks, thanks very much indeed for joining us and sharing your thoughts on what exactly is happening on the ground as far as the United States is concerned. Thanks for that. Well, now it seems that apart from harming humans, the disease can also affect one of the most dangerous predators on the planet, the tiger. Surprisingly, a tiger has now tested positive for COVID-19 in a New York zoo. This marks the first coronavirus case in a tiger. It also is the first coronavirus case in an animal in the United States. Now, Nadia, the 4-year-old female Malayan tiger, had developed a dry cough. According to officials, the test result was confirmed by the National Veterinary Services Lab.
over a course of a week, we had 4 tigers and 3 lions develop mild respiratory signs. They were coughing, some of them were wheezing. And after a couple days of that, when Nadia began not eating well, we anesthetized her for the purpose of treating her and taking care of her and doing testing to determine what was wrong.
Well, Nadia, along with 6 other big cats, is thought to have been infected by an asymptomatic zookeeper. Now, the zoo authorities still do not know which employee infected the tiger, while the other tigers and lions are also exhibiting symptoms. The zoo decided to test only Nadia because she was the sickest. The authorities said that they did not want to subject all the big cats to the tests. According to the zoo, Nadia, along with her sister, 2 other tigers and 3 African lions are expected to make a full recovery. Officials are still investigating how the virus transmitted from humans to animals. Earlier, a pet cat had tested positive for coronavirus in Belgium, while 2 dogs had tested positive in Hong Kong. As of now, there is no evidence that pet animals can be a source of COVID-19. The World Health Organization also states on its website that there is no evidence that a dog, cat or any pet can transmit COVID-19. However, Nature.com had earlier quoted Chinese scientists saying that coronavirus can infect the cat family, but dogs were not so susceptible.